Good morning, everyone. My name is Johanna Scheutzow. I'm a business psychologist at Thrive, and thanks to everyone that's joined today's panel discussion on developing a well-being strategy during COVID-19. So we chose to discuss this topic because as an organizations move from the crisis response to the recovery phase, one thing that's certain is that the way business leaders handle this recovery will really define their brands, and both with their workforce and their customers. So lots of organizations are planning for multiple scenarios, such as the possibility for multiple future waves, and obviously its global impact. So strategies developed during this phase really need to be considered realistic and flexible. So this webinar or this discussion will allow you to ask any questions which you have during the discussion, but we will also have some time in the end. So feel free to ask anything any questions you have for our guest speakers. So joining me today, we have two fantastic speakers who between them have over 40 years of experience working in the organizational well-being and mental health and benefits. And it would be great to start with a short intro from you both. So Paul, I will come to you first.
Thanks, Johanna. Thank you and good morning. Paul Roberts from Enlighten, director, founder, and very serious. That was back in the days when I ran news at 10. It looked with a tie. That looks like from another age and another different world, doesn't it? I must change my imagery. I literally don't know where that tie is even now. You can't even wear them, can you? 20 years of well-being in the industry, helping organisations, be they charities, public sector, private sector, how work impacts on health and health impacts on work. Yes, that's occupational health, but today it's much more about well-being. That's the space we occupy, helping organisations get the most and how to thrive.
Right.
Thanks, Johanna.
Eugene, thank you. Would you like to introduce yourself?
Surely. Good morning, everybody. Great to be speaking today. So I'm Eugene Farrell, and I'm mental health lead at AXA Health now. We are. So we're just changing our name to AXA Health. And so I'm more than 23 years now, I think, with AXA. And much longer, all of my working life has been in the health industry. I'm a specialist in mental health provision, so that's developing strategies, doing consultative work with organisations, and I also chair the UK Employee Assistance Professionals Association. So I'm an absolute specialist in EAPs across the globe. I've been a director of the USA EAP Association, and I've also been on the European board. So all of my work really is around mental health and well-being and the link between the two. And I'm really looking forward to discussing this subject today. Should be a fascinating one, and I think we've got a lot to say about this. So, bring in some questions. We'd like to be able to see those as well.
Great, thank you both. Okay, so this brings me to the first question. Why is this important for organizations? So we have been talking about well-being for years. Lots of companies have developed strategies for well-being. So what's really the relevance of revisiting it now?
Well, let me take this one up first, because I feel, I suppose, quite strongly about this one. We're in an odd world, aren't we, at the moment, with this kind of some people remote, a lot of people remote right now, and we've been back in the office for some people and then back out again, and some people are still at work. And well-being has become a huge focus for organisations, particularly as their employees became more remote. Well, I guess one became affected by this pandemic, this virus that's out there, so the risks associated with that and health, and then the remoteness of people, and also bringing people back into the workplace. So I think the overall the thinking about well-being and the focus on well-being has massively increased. And also remembering that organizations, even though employees are remote, they still have a responsibility for the health and well-being of their employees, even though they're not physically in the same space. And so there's been a lot of discussion around how we can manage that better, and that's probably what we're going to get into a lot today. But there's been a massive emphasis on mental well-being as well. So all of it together is really, really important. And yeah, it's a great time to be talking about it, but you know, on the back of something very difficult, I think, for all of us.
Absolutely. I concur with you, Eugene, and as ever, when we set goals of well-being back in the day, back in March, even if it was January 2020, it feels like a lifetime ago for most of us. People are working at home, people are working on the front line, some people are very worn out, worked on the front line all the way through, and others have been furloughed and had 6 months off. One of my good friends has been furloughed for a whole 6 months and is absolutely loved life. His dog and his cats are having loving life too. They've never known such a good year, a vintage year for cats and dogs and horses, I think, but maybe not so much for the humans in the practice. And well-being is really important. Looking at the impact on those different groups, massively important now, massively important for what comes in the near future and into 2020, 21, maybe even 2022. Working with a wellbeing program that's setting investments, setting goals that are right for the right time, and working flexibly so that what we're doing now might be the same as before, but we've really got to investigate that. Look at what we need to stop, look at what we need to start, look at what we need to continue, and keeping those things alive and well, and making sure that we've got a wellbeing program that's fit for purpose. And if you don't have a wellbeing program, we could certainly talk about that too, as to why you would do it. But yeah, the impact is more now than ever before, and I think it's the right subject for the moment.
And we know that you know, some of the best organizations have wellbeing programs already. So there'll be people who are focusing on it as new, and there'll be organizations who are already doing wellbeing. And I think data shows that the really good organizations are something like 11 times more likely to have a wellbeing program. So it's I suppose it's, you know, we would expect that the really good organizations are already doing it, but other organizations are coming to it and adding more.
Definitely, yes, thank you. Yeah, and it's this general shift, right, which every organization goes through right now, from this crisis response to recovery, which is, yeah, I think a quite unique time right now, and a lot of organizations are faced with these challenges, which come with that. Yeah, great. So this brings me to the second question. So what are the key elements that should feed into a well-being strategy? So maybe you can advise on that.
You're going to go first, Hugh?
No, I'll let you kick off.
All right, here we go then. So a lot of well-being programs are structured on 4 pillars now: socially, physically, mentally, and financially. They can be 4 pillars. You can mix and match them, but if you look at those 4 pillars, and the roof at the top of the house is the aims and the goals, if you look at the loft area is the aims and the goals, you have 4 pillars that come up. That's social, physical, mental, financial. That's a good structure. The business in the community structure uses that. Mind uses that different approach as well. There are a number of different models that you can look up and you work with. But don't forget the baseline. It's very important that health and safety, the security, the risks are covered off, and that the big gains that we actually have on the risks are taken, and the baseline moves up. We are obviously going to talk about stretch and pushing that forward, but we're looking at really taking into the very big gains. But don't forget, particularly through the pandemic, we need to make sure that the baseline is moved. Johanna, could you mind taking the main slide down so that people can see us? There's been a question before.
Yes, of course. One moment.
You stop sharing.
I sort of knew that Paul was going to start on that. That's why I let him go into that. and there are lots of different models of well-being. So whichever one you choose is always going to be a good one to work with anyway. So actually, I can't see on my screen now. Here we go. Yeah, get a model and start working to it. And you know, it's really important to have some sort of structure and to start somewhere rather than, I guess, you know, I think we've probably both seen this in, you know, over the years, is kind of just buying lots of stuff, buying lots of benefits or buying lots of well-being things and adding them all together and thinking that's making a really good kind of strategic approach to well-being, which it isn't. So we've got to start with a strategy and a set of aims, and I guess we'll come on to talk about all of the other things that we need to do. But I think that's really important. But I also wanted to say, you know, when we're talking about well-being, is talking about work as well, and that's something that's really important. Is, you know, good work is also good for well-being. So look at the work aspects, and I suppose at the moment it's focusing on the people. Rather than jobs, but also focusing on the quality of work. And I think those are really important parts of well-being that get forgotten a lot. And so we don't see good jobs, and where we're remote at the moment, there's a lot to talk about also in terms of, you know, how to make the job good, but we can talk about those in the context of well-being. I think we'll get onto that later, I'm sure.
Yeah. No, that's right. And coming back to Paul's comment about the different pillars or the basic framework of well-being, right? Just, yeah, as a thought, like, I mean, you know that those things are relevant, but just thinking of an example. So if someone's got something going on at home that's affecting them, there's really no point in ignoring that or not having the ability to support them because of that thing at home may cause them to be absent, right? So it has this like direct business implications. So this is why it's so important to include every part of this pillar to have this holistic approach, because yeah, if we ignore one, it will have effect on the other, even though because yeah, they're really important. So we have a question here. What will you do in the future to include people with more extreme mental health in part of the wellbeing plans, as we are seeing less help being made available through the NHS due to COVID? Would one of you like to answer that?
Yeah, well, I think it's an important emphasis with organisations at the moment. So line managers are absolutely key to, I suppose, to spotting and looking out for changes that would indicate mental health issues. And you know, we're going through something that's quite unique, and we don't know where a lot of this is going to go, and we're obviously seeing huge levels of anxiety, because we know from the ONS data that's been shown. So it peaked and then it sort of dropped off, but we've seen it coming back. There are huge numbers of people with anxiety around this whole thing at the moment. We've also got potential changes in I suppose the economic climate, in job security, and all of those things that are contributing to this. So that may lead to more complex mental health issues, and as our questioner identifies, that the NHS availability, it was poor, I think, maybe before, certainly patchy, may not be so easy to access in the future, and we know that people are not accessing NHS services for a variety of different reasons at the moment. So the future is complex. So line manager is really important, training for them in looking at I suppose, the signs and symptoms of mental health, but there's a lot more to it than that. You know, it's about developing relationships. It's about them checking in every day with their subordinates and ensuring that you know that they're looked after. It's about ensuring that they have good work-life balance. It's also about things like trust. You know, enabling people to get on with their job and trusting them to do it, and measuring output rather than, you know, the amount of hours that they're doing. It's also about trying to reduce back-to-backing of meetings so that people get, you know, psychological space. And then all the stuff that we're going to talk about with wellbeing would also contribute to mental health as well. But then programs in place, you know, an EAP, we've got to mention an EAP, really good place to start. Many of the large organizations have EAPs, and they're a great place for individuals to self-refer, where they can get assessed, so you have access to counselling, or they can refer onwards past there. And a number of, particularly larger organisations now also have things like private medical insurance with psychological health pathways that link those two things together and can provide access to services, etc. And I guess it would be wrong of us not to get into this conversation without talking about a mental health app, wouldn't it? So those can be hugely important, and there are lots of them out there. Thrive is a great one, I'd have to say, and that enables people to have really good self-insight and to be able to do maybe some work for themselves before things get really complicated and they present on a more clinical level. So, certainly the measurements and the tools that within the Thrive app can be helpful in that respect. So if we think about the whole mental health continuum, it's fitting things into all of those different places. But I could talk about all that all day, but we're not here to talk about a mental health strategy, are we? So I'll stop at that. I think that's probably quite a lot already.
Great, thank you. Yeah, there was another related question from Laura, who how can managers start to have the conversation around mental health if their employees don't raise it themselves, right? So I think this is related to what you already said, right? It's about normalizing the conversation, having it regularly, and also having this mutual feedback, right? So where if you want your employee to share, for example, mental health issues, you also have to share something about yourself. You have to be vulnerable, because it's a mutual thing, and I think it's about normalizing it as often as possible.
I think there's something to learn here also in the kind of new digital relationships that we're all having, which is different than the past. So here we all are now. This is the irony of it. We're watching a digital presentation in a digital world, and we can't be together. And when those relationships and check-ins are happening, which have to happen, I'm a really big believer in line managers doing that regularly. Every day if you can, certainly every week is a must. But it's the learning to recognize those different cues, because we don't have all the other things when we're present, when we're in the same room. So it's looking very carefully about, what are the eyes telling you? What is the kind of posture telling you? And what are the words that somebody's using? So these are kind of new skills that we're all kind of learning to use and to read in a different way. And there are already people who are really skilled at this, who do telephone work, for example, call center work, and they tune in and they listen very carefully, and they already pick up on a lot of these things. But I'm also a big believer in gut, because line managers learn a lot of things along the way, and if your gut's saying something's not quite right, then tackle it. And I don't mean that in an aggressive way, but ask twice. How are you doing, and normalize that conversation. You've got to create that openness, as you were just saying, Joanna. If it's normal to have those conversations, then that would create that openness, and that can apply to all of our well-being. So it's being able to have well-being conversations, I think, is as important as mental health conversations, because that's what we're talking about today, isn't it? It's two sides of the coin, physical and mental well-being.
And keep doing the normal things, keep doing the appraisals, keep doing the one-to-ones. Appraisals seem to have fallen off the agenda because we've all been busy working out on new tech. If you're having an appraisal, you're doing the one-to-ones, yes, you have the check-ins, but do the formal things as well. That may well help identify the people who have got some issues or need some further support. Tech's a great way of helping making human connections work well. We've not seen each other for a long time, and it's not going to happen anytime soon by the minute accounts. So we've got to get used to it. This is the new way of working, and we've got to bounce forward and be positive about it. But yes, it doesn't work for everyone.
Can we go back and talk about the strategy bit, though? Because I think we're sort of left it a little bit incomplete. So, we talked about the pillars, but, what have we really got to do? And I think it's really important that we don't leave the listeners with just thinking, oh, just get those pillars. And, a start point is understand needs, isn't it? You know, don't assume that you know what's best for everybody, because, and this is true of all of the well-being, not just mental well-being, physical well-being. So there'll be differing needs and there'll be different parts of the program. So don't just grab loads of stuff and put it all there. Really start to understand. That's a good part of any strategy, isn't it? Think about what you're going to do, understand the needs first, and you know, you can do that by asking your employees what is it they want, what is it they need, as maybe a good start, instead of just, you know, sitting in a room and deciding what they want. That's I think is a good way to begin it.
A line manager said to me, I actually physically met one of my clients yesterday, and he said, every time I speak to one of my staff members, she's been in a different room. And I literally had to have a conversation with her. Why is she so uncomfortable? And that wasn't her situation at all. She just liked moving rooms. But okay, you can't get the right ergonomic set up in one day, but when she's just on a laptop with a coffee to one side. But interesting, the impact of that individual person. She liked the change. She thought it was a different outlook every day, and that was what suited her. But it's good to ask the question. It's good to interact to make sure it works. It all fits in.
Yeah, absolutely. So needs are important. Board support, really important. So yeah, we do top down and bottom up. I think it's important to personalize well-being to individuals these days and not just have a broad program. So if you can personalize as much as possible, or allow individuals to personalize, I think that would be really good. We'll talk about communication, and I might get Paul to talk about that. How you communicate well-being strategies right now is going to be a big problem, and you know, adjust and be flexible, because this thing is going all sorts of ways. And we were having a discussion the other day about, you know, well-being strategies, and you said a 2-year, a 3-year, a 5-year strategy. It's really difficult right now, isn't it, to have any kind of longer term strategy. So we've got to be immensely flexible around how we do it.
And that your own business may well have changed. Your performance that you're looking for, the performance that the business is looking for from the people that work in it, may well have changed. And does your well-being goals that you used to set, or do they fit in with what the business is looking for now? Literally this week, I'm working on one where it's diversity, equality and inclusion, performance of all service providers are the key metrics that are being investigated. So everything has to work towards those aims, and if they don't, they might be reduced in their focus for the short term. And that's quite right. We just got to make it work for now, and we've got to make it work so that it's relevant. So telling people, hey, we can go to a health screening clinic may well send a shiver down your spine for some people. I would happen to be in a general hospital on Sunday, and they are the cleanest, safest places I've ever been in my life. Everybody's COVID secure, everybody's extremely well behaved, and from a well-being perspective, from the 5,000 staff that work in that NHS trust, they know what they're doing, and there's less fear. But in the front line, behaviour, staff, customer behaviour, we know it's all changed, and that can feed into how you work and your own workplace. We've got to bear in mind there are a lot of frontline workers, as well as those at home. And again, and what the impact is different on each and every group. So communicating to them is tough. Technology can help you, and technology can definitely help you, because a good deal of people have got smartphones. So yes, that can help make the human connections, but getting the right messaging out to them is a tough call for all HR and wellbeing specialists.
No, that's right. Sorry, just thinking. No. Thinking about the needs assessment or the needs investigation. I think this is so important, because if you do that right, like for example, there are different ways, right? You can do focus groups, you can do face-to-face interviews with someone, or you can do surveys around well-being, right? So there are various ways, but it's so important. And this then works best if you kind of do that, because this gives the employees the perception that they can have a say, or that they can contribute to well-being, and this engages them even more. So if you really engage with them and ask them what do you need, or what are your needs, then they will be way more motivated to be part of the whole strategy as well. So,
and Zoom's got breakout rooms now, so you can all meet together and you can have breakout rooms. Teams is rolling that out as well. So the technology can help. And I know Blue Jeans and Slack have already had those sorts of things for quite some time. But you can find those focus groups and you can find that information. But yeah, the impact from a business perspective, the risks have to be identified, they have to be assessed, and they have to be controlled. That's the same for mental health. That's what health and safety executive expects you to do: identify, assess, control. They are the 3 steps.
And I'm glad you said that, Paul, because I think that's a really important part of wellbeing strategy, is work on a kind of risks basis. So, you know, what are my mental health risks? What are my, say, cardiac risks? What are my other risks associated with movement, you know, and being static? What are my musculoskeletal risks of people sitting all day? So if we take a risk-based approach, that can be helpful too, I think, in terms of a wellbeing strategy. Again, it sort of fits into how you build it, and then how you deliver the services, which is a challenge, isn't it, right now? Because gone are the days of, I think, you know, doing know your numbers on site and various other you know, clinics and promotions on site. Those just can't happen right now. So we've got to find innovative and different ways of getting that well-being message to employees, and that's part of the big challenge, I think, at the moment. Whether, you know, whether they're physical or mental, it's still all part of that same communication.
Yeah.
And don't think, you know, the other thing I would say in any of these things is don't stick to the same thing. If you find something isn't working, then do something else and try that. You know, that's old thing about, you know, trying the same thing over and over and expecting the same result. You know, so some messages will hit home for some people and some will hit home for other people. But, you know, if you come up with an idea and you think it's great and it just isn't working, shift the idea. I think that's the flexible and you know, a much more open approach, and be, you know, adjust as things happen. So yeah, that's an important thing. I've seen that a lot, where you just keep doing the same thing over and over and over. And I think we know with things like well-being that if you keep the same messages forever, that you get a gradual decline, don't you, in participation. And you know, people see the same old. So you've got to switch it up and try and do different things, be creative.
Working with a big pharmaceutical client in Surrey, we had they had a lot of people on one campus. In the old days, back in February, that was the old days, pre-COVID, we had a walking group at lunchtime. And then it got so big, we had a jogging group. We then had a running group. We had then we had a triathlete group. We had walking meetings were instigated, so you could have a meeting internally and go for a walk. All really straightforward, doesn't cost you anything. We even had a ladies only group then started walking together. So in the new days, obviously that's not going to work so well, but the technology, yes, you can do it on your smartphone. The new groups on that same organisation, they have a lunchtime group, but that didn't work for everybody because of childcare or elder care. So we have earlies. We have an earlies group. Some people who walk very early in the morning. People who work very late and want to walk when it's later and it might be dark and rainy, but hey. And we also have a solos group. People who are isolated, they live at home and they want to walk, but they didn't feel like they wanted some company, and their colleagues and workers mix up with them on the social media, and they get their step count in. I have to say my step count's horrendous at the moment, so don't challenge me on it. But yeah, we are trying. But it's interesting. It doesn't have to cost loads of money, and that's one of the things with investment in well-being. You have to adapt to the goals, communicate sensibly, and be relevant, because otherwise it will just fall on deaf ears.
And we can still do lots of kind of health messaging and sort of webinars and discussions, you know, just as we're having this. And, you know, certainly within AXA, we've still got a big program of stuff happening. And I'm sure that's replicated in lots of businesses. So, you know, you can you can get people off the almost the drudgery of the work and get into a health subject or talk about something. And then, yeah, my step count is appalling some days, but you know,
just get Salim onto cooking chili cake, and that's what he's been doing for our organisation. And then it was so good, he had to do lemon drizzle cake the next day. I'm not sure how that goes with physical well-being, but it was fun. It was good.
There's been a lot of cake making over lockdown and sort of beyond.
Mine certainly wouldn't do bake off, but you know.
Great. Just a bit conscious of time.
Yeah.
Questions, but I think it makes sense to come back to them later so that we cover the key points, and then we have definitely some time later for the questions. So the next question is, what about data? So we constantly talk about data-driven insight and being data-led. So what kind of data should we actually be looking at, and how could we maybe use or work together with suppliers like occupational health, EAPs? So yeah, your thoughts on that maybe.
Oh, lots of thoughts on this. You know, and let's try and keep it brief. I've seen a lot of wellbeing programs over the years, and one of the things that's really consistent is people might have really great ideas and great programs, but they don't have any measures of what they think success might look like, or, you know, the ongoing kind of trend change within the organization. So you need to get some ideas of what that might be. So, for example, if it's risk-based, you know, might work on how many risks you've reduced through that organization and what those have looked like. If you might use a health age calculator, and so you can look at changes in health age, but you can form a really good dashboard of lots of data from different providers. So you can look at, you know, total weight loss for the organization, you know, how many people attended webinars, you know, what steps were done by people. There's lots of different ways you can sort of measure those outcomes, but you have to decide what is it you want to achieve, and what are those measures going to look like in the kind of longer term, and then how you're going to measure them.
My day-to-day job takes in health insurance and group risk insurance as well, and looking at the data of that. Data has its place. We have to be a bit careful. Cigna have just released information today. 1,500 organisations surveyed. 61% of them all said that they measure something to do with their wellbeing programs. So maybe we have turned the corner. We just need to make sure, as Eugene said, that the data, we don't get too hung up on it. The data gives us indications of where to invest, where to that we are doing it right, we are getting success right, that we can prove it to the board in the terms that they understand. Just literally how many people are engaged, how many people are reading articles, how many people are coming through your virtual door or actual door is always important, and that's free. I worked with some organisations and charities who literally had no money for wellbeing. We worked with the NHS, we worked with charities, we worked with leaflets. How many leaflets were picked up? How many people came through the door? How many people are actually engaging in this subject? Wellbeing and health is still the #2 search in the whole of the world. You can guess what #1 is, and it's not the weather. So data is important to us, but it has its right place. What's really useful from my perspective is to see the beginning, the change that we've made, and where the outcome is. And if we can get those numbers together, then we can show that the impact, and the board will continue to invest. And it's not about the fun, the fluffy things and the interesting things that they see going on, like a smoothie bike. It is actually about real numbers, bringing real human performance back into the business and making a real difference.
And don't forget, you've got all of your regular data, like absence data, you've got maybe your EAP utilization, your private medical insurance, the other insurances that Paul has talked about. They're all part of the data that you would measure on an ongoing basis. So it's collectively putting all of those things together, as well as participation rates. And then, you know, some of the more clever things like health age, which can be really useful. And you might take something like a Wellbeing index. So there are a couple of those out there in the market that you can do as a measure, and then maybe look at it again in 3 months and 6 months and see what those look like. You might have big data sets that you measure once a year, but do snapshot data, you know, monthly, quarterly, just so you can keep on track with where the direction of travel is going, and work with your providers to get the data that you need. So again, that's really important that, you know, all of that data comes together into a place, and understand from the data what it is it's telling you, because sometimes they're measuring different things. So you need to think about that as well.
Yeah, different data sets and different cohorts of people using it. You do have to be careful of the overlap, particularly if you're an organization which has got lots of benefits and lots of different embedded products. You may have 2 EAPs, you'll have a bereavement helpline through the group life insurer, and you'll have medical data coming at you from your health insurer or health trust. And all of those things will come at you. And you do need to be careful that you've got overlapping data, which could lead you to the wrong conclusion.
Yeah, great. There's a question, how can poor reactions to mental health be addressed? Some colleagues can still see mental health as being fluffy and not as important as financial results.
I think education is really important in that, isn't it? Helping people to understand the real impact of mental health on all of the population. You know, 1 in 4 people are going to be affected by mental health in any one year. 1 in 6, I think, is of employees. That's a cost to the business. It's not something that's, you know, fluffy and to be ignored. So in the same way that physical health is important, then mental health too. There's a really good, if you want to look at your EAP, look at its utilization. The EAPA UK website has a return on investment calculator built into there, so you can put your data in and it'll work out what the return on investment looks like, which is always positive and always really useful. So you can see a financial benefit. In fact, Paul published a paper on that very subject just recently, so you can look that up and see what that data looks like. I think it was 7.35 to 1, 7.35 to 1. Am I right?
No, £7.27.
Ah, there we go. I was close. And it was about 7 to 1 return. And we know also, you know, generally when you talk about ROI, that organizations have, you know, kind of more cultural programs that are through the whole organization have almost twice the ROI than you see with organizations who are reactive. So, you know, these are all really important pieces of data, but yeah, I don't think mental health is a fluffy subject at all, but I would say that coming from where I come from, it's a very serious subject. And you know, we all have mental health, don't we?
Yeah.
Just like we all have physical health. So you know, it's important to talk about it in that context of you know, it's part of well-being.
And it's always interesting. That question is a great question, because a lot of us are very far forward in our journey, our inclusion, our acceptance of others. And as we're seeing through politics, we're seeing through social media, there are a lot of people who are not, who are very much retrenching, and social isolation is not helping that. It's important that we've got resilient, adaptable people. And if you've got resilient, adaptable people, then use them, work with them in focus groups, use them and bring them into smaller groups so that you can help. And it's always difficult if you've had somebody who's healthy and strong and mentally healthy, and they've changed through whatever reason, and they now have poor mental health. That can be difficult for colleagues, and be it a manager to others or within the workplace. That can be a difficult scenario to accept for others, and they're no longer as healthy and strong as they used to be. But they may come back. That might be their new normal. But it's for us to accept them. It's a difficult journey, but it has to be addressed. Today's work challenge.
I knew someone was going to say new normal. I'm playing a mental game of cliche bingo here. Nobody said unprecedented times yet.
You just did.
Just to get it in, yeah.
Great, no, that you're both right, you're completely right. So this brings me to the next question. How far should businesses be planning their strategies in advance?
Yeah, so, we started to touch on this earlier, didn't we? And probably, in the old world, the pre-COVID world, there's an important thing, like we wanted to talk about, post-COVID, which we're not post-COVID, we're second wave, aren't we? We're still, in COVID. So I don't think we can talk necessarily about post-COVID yet, and that's an important part of the planning. But in the old world, you would have probably talked about, a 1 year, maybe a 3 year, and maybe even if you're ambitious, up to a 5-year strategy. But it's going to be a lot shorter now, isn't it, in terms of our well-being goals, because we don't know where all of this, where is the world going to be in 3 months and 6 months and 9 months. And so probably we need to bring our strategic aims in, but you can't work really short. So 3, 6, 9 months is probably a good set of aims. I think maybe not, I don't know, Paul might disagree with that. I don't know.
A little bit.
I'm
intending to aim for end of next year, and that's just because we're human. COVID doesn't understand the Gregorian calendar, but you and I do. Yeah, that 14 months in advance, it works with business budgets. And why are we doing well-being? You've got to invest, you've got to show investment and return. So yes, you've got to work within the business confines, but equally, if you go too far forward, you will lack relevance and you'll end up in undoing everything. If you have your aims, if you have the pillars that you're working to, you can work within the framework. To give you an example, I have a client at the moment who's looking at internal COVID testing for antigen and antibodies. They have frontline workers who can't be replaced. They're a very specialist skill set, and they're trying to reduce anybody who wants self-isolation. Currently 14 days, they're trying to reduce it down to 4. So these very specialist individual workers who have to work face-to-face with people without masks and without PPE, that is the nature of the work. They're trying to reduce that isolation. If their kid gets COVID or there's a COVID outbreak in school, they have to self-isolate, they test, they get back to work within a 4-day period. That's the aim. So you've got to be adaptable. Is that the right thing to do? Is that the right risk? Is that the right identification, assessment and control? Probably for that group, but it might come to more of us. I literally was talking to a publican who said he thinks we will be doing 15-minute tests and everybody will come to work, take a test, 15 minutes later you'll start work if you're clear. If that's true or not, I don't know, but we'll need to work it through, and we need to keep flexible within our approach to make sure that we're ready for those things if they come about.
We keep saying flexible, don't we, and adjust. I think it's also important that you set some, in terms of your strategy, you set sort of we said aims and goals, but also work with a wellbeing calendar of events. So you can set particular subject areas that you can tackle as you move through the year, and over a 12-month period you can tackle quite a lot, really, rather than just reacting and jumping from one thing to the next and not having a clear set of aims. Is build it around a set of different subjects. And I think lots of organizations would have built it around like health days or whatever. So we had mental health day just recently, and so you get a lot of activity around that. There's lots of these things that happen. There's an entire calendar of them, so pick and choose some of those, and maybe some of your providers have already got stuff that's scheduled around those kind of calendar things, those key calendar bits through the year.
And it fits in with data. One piece of data that's come to us in the last week, HCA hospitals in central London are showing a 76% decline in people presenting for heart and cancer diagnosis and tests. That is massive. Those people still have those issues, but as a community, we can promote early intervention, still get your consultation, virtual consultation, still go for the test in a COVID-safe way. That's an important message, and it fits very strongly. It gives the data, it shows that we've already invested, we're just using the services in the most appropriate way. But we know it's a 76% decline. That's an absolute fact. Extremely worrying as well, because if you present late, the chances of recovery are much worse.
I think that's really important point, Paul. It's we're seeing this a lot in hospitals where people are just not presenting. You know, the NHS waiting list is expected to double. Cancers are undetected. So we're here today talking about well-being, but it's health and well-being, isn't it? So those really important health messages are still absolutely important to get out there and people to go and seek medical advice where, you know, they think something is not right. And it's not a burden to the NHS because, you know, this increased complexity will cause a bigger burden to the NHS with late presentation as well. So, you know, it's important to encourage employees to get tests and checks or whatever they need to have and to present to their GP or hospital or use their private medical insurance too. Yeah. Sounds a bit dark, all of that, but they're important health messages.
No, that's true. And you both already kind of went forward to my next question. I think, yeah, just it's fair to say, right, certainly during the pandemic, a lot of the focus has been on mental well-being. We know that a lot of people's mental health has been massively affected during the pandemic. And I think for some businesses, the focus for 2021 will naturally start to evolve around that. But yeah, as you said, but what about the other pillars of well-being, right? So we've talked about should they be considered more or less equally or as important, and yeah, I mean you already answered to this question in a way, but if you have any other thoughts, please let me know.
We're going to have another question.
Great. Okay. Then there are a few questions from attendees.
Shall I pick up on one of those now, Johanna?
Yeah.
So a couple of the questions have been about long-term mental health and long-term cases, and we've also had questions about extreme situations as well. A lot of that is one of the key things from HR, key things from the participants to consider is what you already have. Time and again, I hear from clients who have got a situation brewing, and you remind them, hey, you've got that EAP, you've got that Thrive Mental Health app, you've got that cash plan, health insurance, whatever it may be. Look around you, remind the workforce that you have all of those great and wonderful things that you've invested in and spent all that time buying. Make sure they know that they're there, the touch points. This is a touch point. It might be a flash point, but it's remind them that the services are available, remind them what they're there for and how they can access them, and nice and easy ways of accessing. Sometimes I have one of my clients a little cheat sheet of just all the numbers and all the links, and occasionally just blast those out to people so that they can just click on them if there's something of concern to them. If it's money, they can click on the financial well-being person that leads and champions that area. So that's one of the ways to do it. Yes, make sure they're obviously if it's a physical or mental health where they're taking medication compliance is very important, and also making sure they're looking after themselves. Very simple, very human. You don't have to get too involved. You can just ask the questions and ask delicate questions around how is that? You know, I can see you've changed today. What's going on with you? Those are simple questions that help open and start the dialogue.
There was another really interesting question. What's the best way to communicate with those who aren't tech confident? For example, in retail, where there are some employees who don't use their internal communication side or have a smartphone. So how do you get well-being feedback from these populations?
Yeah, they're always, I think, a challenge. Although, you know, large numbers of population do use smartphones, but there are people who don't. Or choose not to, and you know, I understand that. So, you know, where you've got a management structure, so line managers downwards doing briefings, you know, some organizations have like daily huddles where they share information, they talk about, you know, the good, the challenges that are coming up, and you can build your well-being messages into those, a kind of a drip through all of those. There was one of the things that I talked about, very early on in lockdown about communication, which was about using the post. So, why can't we go back and use leaflets that we post to people? And I was talking about it in the context of, line managers not sending an e-card to somebody saying well done, but sending a thank you card, which I think is a lot more personal. But I also talked about it in terms of older people and communicating with them and dropping something through the post.
Oh dear, I must be old. Somebody sent me a croissant, orange juice, and some other items, and then we had a business breakfast a week ago.
Yeah, so that's a little creative way, isn't it? Sending something out. So you can use the post or a package or some way of doing it. So leaflets or I don't know, a wellness product, a wellness bar, a coffee thing. There are ways that you can communicate with people that are beyond that, as well as colleague to colleague and line manager downwards, and small groups from line manager with their own small groups are still a powerful thing, and encouraging people in that way. So I recognize that it is a tough challenge. And workplaces that are still working, there's still posters and back of toilet door and the notice board, and all of those things are still valid ways of communicating.
Yeah, on the other side, there was another question, like how do you communicate a well-being strategy to your staff virtually? So yeah, the other side of that, what do you think is the best way to do that? And I think, we touched on that, right? It's about the communication strategy, using all the communication tools which are available, which can be anything like, we have, for example, one client who uses like a small note under their emails to just, let them know about different well-being events, or like that can be small things, right? It's just about getting the message out and reaching as many employees as possible.
Somebody just made a comment about sending cocktail kits out and having a cocktail hour, which is it's an interesting piece of well-being, isn't it? I'm sure it's really good to get the team together and shake your cocktails together. Maybe you can do it with non-alcoholic cocktails, as maybe we don't want to encourage too much alcohol usage, but that's a kind of creative idea, isn't it? Send a smoothie kit out, or some way of doing something that's more remote.
And have fun. That's the other thing, is there's some really serious stuff in here, but you need to have fun with it. You need to have fun with the well-being, and your well-being strategy needs to build in a bit of fun, but try not to be too contrite with it. Yeah. A cocktail hour, if it suits your mix and it suits your people, brilliant. Absolutely fantastic. Love it.
Like a running t-shirt or something, and then encourage people to socially share that if they can, pictures of them actually doing the activity with the t-shirt on. I mean, and we do have to watch the opposite side to this. If you over promote the kind of the over well-being aspect of it, then you create an ideal kind of well-being-ish person, and that can often put other people off, that they can't achieve that. So we do have to balance the two out. So it's again about stories of ordinary people just doing stuff, and they don't, I think in a lot of these things, don't aim for the moon, do little things. So just walking more is a well-being activity. Go to the park and take a walk I'm a big believer in walking in nature. Just doing that is a well-being activity in itself. So you don't have to do a 10K to be well-being orientated, or to start making changes. You can just go for a 10-minute walk.
Thank goodness for that.
No, there's also Emilia asked if you have a favorite or desirable well-being initiative or tool by the majority of workers, if you have any recommendations around that.
What's the favorite? Well, the one I suggested, which was the walking clubs, and now linking up on social media. That's the one I just think is fun. It's cheap, it's free. You don't have to pay if you're on your inclusive minutes on your phone. That's one of my most favourite at this time.
I mean, there are things like walking groups out there, aren't there? Like the Ramblers UK, and a lot of kind of local organizations organize these kind of social walks. So where people are on their own, they can join these groups socially distanced and go and do, you know, a walk with another group of people, and you can sort of research those on the internet. But organizations could promote that sort of thing as well. My big initiative, the thing that I like a lot is, I talk about it a lot, is seeing the sky above your head, is rather than a ceiling. We've all got ceilings above our heads, haven't we? So getting out into the real world is a really good start. It's good for the head, good for the body. Go and walk by a river, a lake, a canal, in a forest, take the dog, go walk with a friend. I think those are really important parts of just maintaining a piece of well-being at the moment and getting away from sitting in our chairs all day.
Yeah. No, I agree. Getting out is so important, especially with the reduced light now and the clocks being switched back. It's just, yeah, having this daily light, daylight out there, and maybe even meeting other people when you're outside to get the social contact, which we are all missing when we are at home and working from home. There's another question: how can we make mental health a priority in organizations when it's not a generalized concern in society, government initiatives, especially during economic crisis where the most at risk financially and mentally?
It doesn't have to be mental health. It can be whichever subject you're choosing. If it's mental, physical, social, emotional, whichever way you're pushing it, there's always a call on the pound. The data does help because obviously you've got benchmarking from where you started, if you're going to put a change in and how that moves. And some of those actions that we've been discussing don't need any cash. They just need positive action, bouncing forward and actually doing something new and different and making a change and measuring that change. For mental health particularly, yes, it is important. I don't know. I work with charities, government organisations, NHS trusts, private organisation, PLCs. I don't know anybody who's not saying to me mental health is not a problem or is not something that should be a focus. That isn't resonating with me. What they are asking is, what can I do about it in the workplace, given this set of circumstances? And if I've got people who are furloughed, people who are at home, and people on the front line actually working, there's three different audiences alone, let alone, there's three very big groups that need to be addressed, and they need addressing in different manners. So it's what's right for your organisation, what's impactful, and what's culturally correct for your organisation as well. That would be my pointers. But the call for the cash is always a strong one, and yes, it has to be put down to your organisation metrics and what success looks like.
And you can break mental health down and maybe not do huge, big mental health things like it's a massive program, but think about, smaller ways of approaching it. So do a thing on resilience, and I've done little webinars on almost like mini subjects. So you might do something on, say, imposter syndrome, which is an interesting way of kind of talking about anxiety, but in a slightly different context. Gratitude is another kind of soft way of talking about mental health in a different kind of way. So do little bits and talk about it in that way. And that way you could just sort of almost like sneaking in the mental health without kind of the big labeling of, now we're going to talk about mental health, which kind of feels that big stigma piece that we don't want to get into. So and I still think, we're almost seeing a resurgence of discussion around stress again, aren't we? That's becoming it's back again. And so, stress management is an important part of talking about mental health. And you can talk about that as part of resilience or talk about it on its own.
No, that's a good thing. Here was another comment from Thomas. Should our strategy be focusing on building resilience so that people have the skills?
Absolutely, they should. Yeah, that's absolutely key right now and going forward. The whole COVID fatigue thing resilience is really important, and I think what we know about resilience is it's not reliable. So what worked in the past may not work in the future. You may have been brilliant in the past and resilient, you may not be in the future. So we all need to kind of look out for our resilience. And I guess one of the important things, the power of the group is really important. So get your people talking together, allow some time and space to talk about stuff that isn't just work. So maybe build that into meetings, a bit of time to do that. But the group collective and the way that groups support each other is incredibly powerful. And so encourage that as well. I'm a big believer in group collective.
Yeah. Great, we're running out of time. They're very specific.
I can see.
Yeah, we have a few very specific questions. I'm sorry if we can't every questions, but I will share the contact details from our guest speakers. So if you have questions later on, feel free to contact them. So here they are. Yeah. So this brings me to the end. Thank you everyone for participating and your attention during this morning, and a big thank you obviously to Paul and Eugene for your expertise. And I think this discussion has certainly offered some food for thought, and I hope that it's provided you with some helpful insight. And if anyone has any follow-up questions, as I said, feel free to get in touch with either of our guest speakers or with Thrive or with me. So thank you very much. Thank you for joining us.
Thank you, Wendy.
Thanks.
Be kind, everyone.
Yes.